Welcome to the July 18th, 2023 Legislation and Regulation Committee meeting. My name is Jessica Crowley, chairperson of the committee. Before we convene, I would like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. As I facilitate this meeting, I will announce when we are accepting public comment. I've advised the meeting moderator to allot 3 minutes to each individual providing public comments. We will begin with public comments for individuals attending in person, followed by public comments by individuals participating via WebEx. This approach is necessary to facilitate the meeting. Before we get started, I would like to ask staff moderating the meeting to provide general instructions on the process for providing public comment via WebEx.
This is the moderator. When the appropriate time comes, we will display instructions as these are, and people will be given the instruction to either raise their hand by clicking on the hand icon or looking for the question mark icon, typing the word comment and click send, and anyone who chooses to call in may always press *3 to raise their hand, and each person will be given 3 minutes to speak with a 10-second warning. Thank you.
Thank you. I would now like to take a roll call to establish a quorum. Jose de la Paz.
Present.
Thank you. Trevor Chandler.
Present.
Thank you. KK Jha.
Present.
Thank you. Maria Serpa.
Licensee member present.
Thank you. Nicole Thibault is not attending, and then I am present. A quorum has been established. Members, we have a full agenda for our meeting today. I ask everyone participating today to be respectful of the work before the committee. We encourage participation by members of the public throughout our meetings at appropriate times. The committee respectfully requests that when comments are provided, they are done so in a professional manner consistent with how the board and the committee conducts its business. Moving on to agenda item 2, public comment for items not on the agenda. You will now have the opportunity to provide public comment. You are not required to identify yourself, but may do so. I would like to remind everyone that the board cannot take action on these items except to decide whether to place an item on a future agenda. Members, following review of the public comments for this agenda item, I will ask members to comment on what, if any, items should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, rather an opportunity for members of the committee and members of the public to request consideration for an item for future placement on an agenda, at which time discussion may occur. We will begin with public comment from individuals participating in the Sacramento location.
Steve Gray, pharmacy educator. I would suggest that the committee put on a future agenda a concern about the Business and Professions Code 405.2. During the Sunset Review Committee, a great thing happened in that 405.2 was amended to add that all pharmacists in California with a license could work under a collaborative practice agreement. Which means, in effect, they could write prescriptions, and that those prescriptions they would be responsible for them. They would be under their name. They would be under their NPI number. They would be under their DEA number, et cetera, if it was a controlled substance. Unfortunately, though, over in the definition of prescription, 405.2 was not referenced. And if you look at under the definition of a prescription, the other sections where pharmacists can write prescriptions, 405.2.1, 405.2.2, and 405.2.6, are all referenced under the definition of a prescription. So we now hear from health plans that they're not sure that when a pharmacist has a collaborative practice agreement under 405.2, that because it's not referenced under the definition of a prescription, they're not sure it's a real prescription. And they're hesitant about honoring that on a drug benefit. They're hesitant about what that means. So I would suggest for a future agenda item discussing whether there should be eventually a modification one way or the other to reference 405.2, and I think it's A13, over to the definition of a prescription. And then also there's many other places where the other sections are referenced for under the both the Health and Safety Code and the Business and Professions Code. And you might want to look at those places and then ask yourselves whether 4052 should be referenced there also. Thank you.
Thank you. Seeing no other comments at the Sacramento location, moderator, we are ready for public comment from individuals participating via WebEx.
Certainly. And if you have a comment to make and you're participating through WebEx, you can look for the question mark icon, typically in the lower right of your computer screen or behind 3-dot other options if you're on a mobile device. And our call-in users can press *3 to raise their hand. And instructions are on the screen. We do have one request for comment from John Gray. And John, I'm going to send you a request to unmute your microphone, and you will have 3 minutes.
Hi, thank you very much. Good afternoon. This is John Gray. I'm a registered pharmacist with Kaiser Permanente. And I just want to echo the comment that Steve Gray just made as it relates to 4052A13 and the fact that that authority that's granted under 4052A13 is not echoed in the definition of what constitutes a valid prescription. And so we would agree that we would like to see a discussion of that at a future committee meeting. Thank you very much for the opportunity to comment.
And this is the moderator. I do not see any additional requests for comment. Shall I close that feature?
Yes, please. Thank you.
You're welcome.
I will now bring the discussion back to members. Are there any items that you would like placed on a future agenda? Okay. Since no other members are speaking up, I will say I actually would like to see this on a future agenda, so hopefully we can have that in the future and keep this discussion ongoing. Moving on to agenda item 3, approval of April 18th, 2023 committee meeting minutes. Members, included in the meeting materials is draft minutes from our April 18th meeting. As we begin, I will ask if members have any questions or comments on the draft minutes from the April 18th, 2023 meeting. I would also entertain a motion if you believe such action is appropriate.
Move to adopt the minutes.
Thank you.
Second.
Thank you. With a motion and second on the floor, I will now open the discussion for public comment on the April 18th, 2023 draft minutes. We will begin with public comment from individuals participating in the Sacramento location. Seeing no public comments, moderator, we're ready for public comment from individuals participating via WebEx.
Thank you. And if anyone participating via WebEx has a comment on the minutes, instructions are on the screen. You may raise your hand by clicking on the hand icon, or you may look for the question mark icon, click that, type the word comment into that text box, and click send. Each speaker will have 3 minutes with a 10-second warning. And at this point, I do not see any requests for comment. Shall I close that feature?
Yes, please. Thank you.
You're welcome.
I will now bring the discussion back to members. If there are no additional comments, I can take a roll call vote. Okay. Jose, how do you vote?
Yes.
Thank you. Trevor, how do you vote?
Yes.
Thank you. KK, how do you vote?
Yes.
Thank you. Maria, how do you vote?
Yes.
Thank you. And I vote yes. The motion passes. Agenda item 4, discussion and consideration of pending legislation impacting the practice of pharmacy, the board's jurisdiction, or board operations. The legislature is on summer recess and will reconvene August 14th. July 14th was the last day for policy committees to meet and report bills. September 1st is the last day for fiscal committees to meet and report bills. September 5th through 14th is limited to floor session only, and September 8th is the last day to amend bills. Interim recess begins upon adjournment September 14th. Members, as indicated in the meeting materials, and including the materials passed out today with copies in the back of the room, there are 15 measures for our consideration, which include 3 with board-sponsored provisions. As legislation is very dynamic, there have been few changes to some measures since the release of the meeting materials. In general, I do not plan to extensively read the information contained in the meeting materials. However, where changes have been identified, I will highlight them for members. There are a few measures that were not previously considered by the committee and board. I will highlight those measures where appropriate. Additionally, you may note that there are some measures that were previously considered by the committee and board that are no longer included. Generally, this is because the measure either no longer impacts the practice of pharmacy or is not moving. These measures include Assembly Bill 602, which was amended to address false advertising of pregnancy-related services. Assembly Bill 1619, which was related to pharmacist disclosures of cannabis interactions. Senate Bill 524, related to pharmacists furnishing specified prescription medications based on CLIA-waived tests. And Senate Bill 826, related to criminal history information, are not moving this year. With those brief announcements, we will now proceed to the measures on the agenda. Assembly Bill 317 would require a health service plan and specify disability insurers that offer coverage for a service that is within the scope of practice of a pharmacist to pay or reimburse the cost of services performed by the pharmacy at an in-network or out-of-network pharmacy as specified. As we previously discussed, the licensing committee has received public comment from pharmacists detailing barriers to patient care stemming from a lack of reimbursement. The measure is sponsored by the California Pharmacists Association and National Community Pharmacists Association. The board established a support position. The measure is back in the Assembly pending concurrence with Senate amendments. Members, do you have any questions or comments on the measure? Hearing none, we will begin with public comments from individuals participating in the Sacramento location. Hearing no public comments in Sacramento, moderator, we are ready for public comments from individuals participating via WebEx.
Thank you. And if anyone would like to make a comment, the instructions are on the screen. You may look for the raised hand icon, click that once, or you may look for the question mark icon, click that, type the word comment, and click send. Each speaker will have 3 minutes, and our call-in users can press *3 to raise their hand to ask to comment. Are there any comments? I have one request for comment from someone logged into WebEx as Keith Yoshizuka. Keith, I'm going to send you a request to unmute your microphone, and you will have 3 minutes. You're unmuted.
While I applaud the efforts to expand coverage to pharmacists who engage in clinical activities, I don't believe that the bill goes far enough. It restricts payment to pharmacies and leaves out a major segment of the pharmacists who write prescriptions, which is those practicing in an ambulatory care environment. In other words, a medical clinic not associated with a pharmacy. I know it's late in the game now, but I've been trying to raise awareness about this since the bill was introduced. Thank you for your time.
Thank you.
And I do not see any further requests for comment. Shall I close the public comment feature?
Yes, please. Thank you.
You're welcome.
I will now bring the discussion back to members. If there are no additional comments, I will move on to the next measure. Members, Assembly Bill 663 would allow a mobile unit deployed as an extension of a county-owned pharmacy to carry controlled substances approved by the FDA for the treatment of opioid use disorder under specified conditions. This measure follows up on last year's provisions, which created the initial authority of the use of mobile unit as an extension of a county-owned pharmacy. Recent amendments would allow for a county to use more than one mobile unit if deemed appropriate by the PIC. The board established a support position. The measure is included on the Senate third reading file. Members, do you have any questions or comments on this measure?
I just want to reiterate my support for this, especially in San Francisco as we're trying to deal with the opioid epidemic and in all of the above capacity. This bill will allow significant operations to allow us to further address that. So just continue to be in support of this bill and excited to see it moving forward.
Great. Thank you, Trevor. We will now accept public comment from individuals participating in the Sacramento location. Seeing none, moderator, we are ready for public comment from individuals participating via WebEx.
And we have reopened the Q&A feature of WebEx for public comment. If you'd like to make a comment on 663, you may look for the question mark icon, click that, type the word comment and click send, or you may raise your hand by clicking on the hand icon, and calling users can press *3 to request a comment. Are there any comments? I do not see any requests to comment. Shall I close that feature for now?
Yes, please. Thank you.
You're welcome.
I will now bring the discussion back to members. If there are no additional comments, I will move on to the next measure. Members, Assembly Bill 782 would amend Business and Professions Code Section 4126.8, which specifies that compounding shall be done consistent with the standards established in the USP compounding chapters. Specifically, the amendment would add to the section that compounding does not include the adding of a flavoring agent to enhance palatability. As we begin our discussion, I want to confirm that members received the supplemental information received specific to this measure, including the one that was distributed today. I share the concerns raised in the meeting materials raised by staff. As a board, we are familiar with the federal provisions related to compounding, including the requirements a compounding pharmacist must satisfy to meet the exemptions of the Federal Food, Drug, and Cosmetic Acts. I agree with the staff recommendation that an opposed position is appropriate. I believe it places licensees at risk of inadvertently violating federal law because of the confusion this measure could create. As members may recall, as part of the board's discussion of proposed changes to the board's compounding regulations, the board received comments requesting that the board exempt from the definition of compounding the adding of flavor agents similar to what is being proposed in this measure. As I shared during that meeting, I have personal experience adding flavoring agents, and the requirements necessary are important for patient protection and are also very easy to comply with. I have read the supplemental materials provided specific to this measure. I think it is very important to highlight that neither the board's prior discussion nor my comment today should be construed to indicate that I am opposed to the use of flavoring agents. To the contrary, the use of flavoring agents is important in for some patients to ensure medication adherence. As I open this up for discussion, I would appreciate members' thoughts on this measure. Members, I would also entertain a motion to establish a position on this measure if you believe such action is appropriate.
This is Maria Serpa. I'd like to echo our chair's comments on that. I'm very disappointed and concerned that such a bill is coming forward that would only confuse our licensees and perhaps the public also. This does not change the national standards that would still be required. It does not change the access, which access to flavoring agents is appropriate in some situations like you mentioned. We're not creating any barriers. What USP has just asked that it be considered as compounding and require documentation. This bill would imply to licensees that this would be exempt from documentation, and that would not be true, and the confusion that would result would be very unfortunate. So I'd like to move to accept an opposed position. Thank you.
Thank you, Maria.
I'd like to add that defining addition of flavoring agent or palatability will constitute this as a additives to the prescription, and pharmacists will have to get a new prescription or the authorization to compound that medication unless they are authorized to suo motu add ingredients to the prescribed prescription. Having known personally in practice that these are the prescriptions generally used for pediatric patients for flavoring, this is adds some more time for consumer or patient to get access to that medication. They have to wait for pharmacists to get that clarity from the prescriber. So I would say that it definitely needs some more refinement. So I will like to add that comment that I will not be, I would like to see that added so it does not go in the way where it adds to a process which is already very critical for a emergent drug access.
Thank you, KK. I think that's a really good point, and hopefully we can bring that to the medical board's attention as well, just in case, you know, we do run into situations where we're asking for an additional prescription or for the prescription to actually indicate that flavoring is allowed, just to make sure that we streamline everything.
As the standard of practice today, that question is not being asked, so that is not a rate limiting step or not a time additional step today. But if it's considered that way, then I would certainly assume that pharmacist has to ask that question before they go forward with the addition of that ingredient.
Thank you.
I'll second Maria's motion.
Thank you, Trevor. Okay. We will now accept public comment from individuals participating in the Sacramento location.
Good afternoon. Erin Norwood on behalf of FlavorRx. I would urge this committee to reject the recommendation to oppose AB 782. As you well know, the Board of Pharmacy has allowed the practice of adding flavoring agents for decades, explicitly putting language authorizing pharmacists to do so in regulations in 2010 and again in 2017. AB 782 simply codifies the exact language in Section 1735B of the Board's current regulations, stating that compounding does not include, among other things, the addition of flavoring agents to enhance palatability. The recommendation of oppose is a stance that supports limiting access to those patients that would otherwise not take their medicine. You've stated that you are not making it illegal, but to offer flavoring, a pharmacy would have to have a prescription from a doctor and be a compounding pharmacy to do so. But you well know that most of the 3,000 community and independent pharmacies in California that currently offer flavoring cannot and will not take on the additional cost and regulatory burden to convert. With far fewer compounding pharmacies statewide, parents and children will simply be denied access to flavoring. That denial of access will be even more pronounced in rural and underserved areas of the state, and for those children with severe or chronic medical conditions who need the medication daily or several times a day. The board has stated in previous hearings that its hands are tied by the passage of AB 973 by Assemblymember Irwin in 2019. AB 782 will untie your hands and leave things status quo. Nothing has changed. There is no new federal law or guidance that compels the board to change its position on flavoring now. USP and FDA definitions have not changed in nearly 20 years. And it is noteworthy that Ms. Irwin is a co-author of AB 782 because of this unintended circumstance that would limit access to beneficial flavoring. The board staff analysis predicts a fiscal impact of the state based on education of licensees regarding federal law. Status quo being maintained, there is zero financial impact to California as a result of AB 782's passage. In fact, should AB 782 not pass, there is a massive cost to the state. Education of pharmacists on the new requirements and enforcement activities to ensure compliance are the most obvious. If pharmacies choose to comply with the onerous USP requirements the board has proposed, pharmacists will be asked to do more for a service that they already provide without issue. In closing, the board has repeatedly stated today that protection of the public is paramount. There is absolutely zero proof that flavoring hurts people. More than 6 million children in California and their parents have benefited from pharmacies flavoring children's medication without a single incident. Flavoring is, however, proven to help children take their medicine. A vote to oppose 782 is a vote against consumers and children. Please reject the recommendation of oppose and instead support AB 782. Thank you.
Thank you.
Good afternoon, Lindsay Goldhorn with the California Community Pharmacy Coalition. We'll keep it brief. Just want to echo the comments of Ms. Norwood. The intent of AB 973 was not to ban flavoring. It was to require the board to regulate to the minimum of USP. AB 782, I think, fixes that problem for you. And I think from our concern, from retail pharmacies' concern, is that without AB 782, flavoring will stop because of the requirements that will be put in place requiring pharmacies to compound. There's also the prescription requirement that Ms. Norwood outlined. So we would implore you to take a support position, or at least not an opposed position, because we do want to make sure that flavoring continues. This is an important service for patients, for children. Without this, medications either won't be flavored, or parents will be forced to do the flavoring on their own, which I know you've all heard is dangerous. So we support the bill and hope that you will as well. Thank you.
Good afternoon, board members. Lori Walmsley on behalf of Walgreens. And I'd like to echo some of the comments that were made by Dr. Jha, as well as some of the other members of the public. For those of you that didn't attend the NABP annual meeting, there was a pretty comprehensive presentation that was given by the USP Expert Committee. And one of the things that was said during the Expert Committee's testimony is that this is not a new position of USP. What's new is that they have a guidance, they have an FAQ. That has been included with the updates to USP 795. So as you guys have heard from Ms. Norwood, this is not really a new position that the California board has had. This is not a new position of USP either. So again, I would like to implore you, I don't think that you need to make the decision to oppose this, and I would encourage you to consider keeping this service as broadly available as possible. I do not believe that there is any federal provisions that would require you to, that would require pharmacies to do this if this bill were to pass. So please keep these products available for your consumers. And I would encourage you to reach out to the USP Expert Committee if you have questions about it, because they were very clear on the record that this is not a new position. And really, this is a contrary position to what your board has taken in the past. So thank you.
Seeing no other public comments in Sacramento, moderator, we're ready for public comments from individuals participating via WebEx.
Thank you. This is the moderator. If anyone would like to make a comment, the instructions are being displayed. You may either raise your hand by clicking on the hand icon. You may look for the question mark icon and click that and type the word comment and click send. And our call-in users may press *3 to raise their hands. We do have a couple of requests for comment. The first is from someone logged into WebEx as Libby Banny. Libby, I'm going to send you a request to unmute your microphone, and you will have 3 minutes to speak. You're unmuted.
Hi, good afternoon. This is Libby Banny. Thank you for your time. I'm just here to echo some of the positions that were already stated by colleagues in the room, and also speak to some of the legal issues that may be giving the board pause. As you know, the board and the state's primary responsibility is the protection of public health and safety above everything else. That's your job. That's the job. And AB 782 protects public health and access to these palatable medicines. As you also heard, for nearly 20 years, the board has chosen to not treat flavoring as compounding. There's nothing new here, as Lori just mentioned. And most importantly, if you were to take an opposed position, the new thing would be that patients would lose access to flavored medications. This bill merely codifies your own historic and current position. The recommended position to oppose this bill seems to me to be based on a technical and theoretical legal risk. This is both bad for Californians and legally unnecessary. When AB 752 passes, it will remove flavoring from the California state's definition of compounding, and thus any requirements applicable to non-sterile compounders under USP 795 do not apply. Whether or not the act of flavoring constitutes compounding under FDA's definition is irrelevant because the state of California is the enforcement body for pharmacists in California, not the FDA. The FDA has no actual jurisdiction over 503A pharmacies, only the state. Unlike 503B outsourcing facilities, non-sterile 503A pharmacies hold no FDA license or registration. This means there's no actual risk that the FDA will show up and inspect a 503A facility. This is the sole providence of the state. Likewise, 503A accreditors have no public health incentive to deny accreditation to California licensed 503A pharmacies that are in compliance with California law doing the service. Simply, there's just no real conflict of law scenario that would disrupt the California licensed pharmacies from taking this position. The board's technical concern seems misplaced, and moreover, it will do damage to public health in contrast to your mission. Patients should be the state's priority, not this theoretical and wholly unwarranted academic legal risk. Further, it's the state's and the board's job to protect public health and do so in the best interest of constituents, and not to worry about these theoretical conflict of law issues. California officials have never been shy taking affirmative pro-consumer positions, even when there is an actual conflict of laws and an actual true legal risk. Take, for example, cannabis, where the state has taken a position that's clearly in opposition to federal law. Here, the legislature, regulatory authorities, and governor's office chose to buck federal law in favor of constituent service. In opposition to this, the state of play in compounding shouldn't be up for debate. The FDA does not have jurisdiction over this definition and does not have jurisdiction over your licensed regulated compound pharmacies. That's your job. The state has allowed flavoring in non-compounding settings for more than 20 years, and patients have benefited. No one's been harmed, and there's no reason. Thank you for thinking about what other states are doing and not putting California on an island and patients at risk.
And our next request for comment is from someone logged in as Ned Milankovic. Ned, I'm going to send you a request to unmute, and you will have 3 minutes to speak. You're unmuted.
Good afternoon. This is Ned Milankovic with the law firm of Mutschellis. Thank you very much for this opportunity to speak to you about excluding flavorings from compounding in Assembly Bill 782. First off, I want to remind this board that never in its history has it prohibited flavorings from being added to medications at a community pharmacy. Never. It's always taken the position that it's allowed. It's good for patient care, it promotes drug compliance for the children of California, and it makes good health sense. Suddenly, though, the board chooses to ignore its history and stated most recently that its hands are tied by the California legislature as the reason for its prohibition. So recently, this board was told by certain key career people at the board that your hands are tied, and therefore you as a board must collectively include flavorings in the definition of compounding. But as you've been told so many times, this is simply false, because section 4126.8 does not define compounding, and no provision in California law does either. This board can therefore exclude flavorings from the definition of compounding by rule, and no action taken by the legislature stops the board from doing so, but you haven't done it. 503A arguments fall flat. The legislature now wants to untie this board's hands because apparently the board believes its hands are tied. They're doing your job for you. They're excluding flavorings from compounding in Assembly Bill 782 for you and for the children of California.
I do not see any further requests for comment at this time. Shall I close the public comment feature?
Yes, please. Thank you.
Thank
I
you.
will now bring the discussion back to members. Members, do you have any additional comments before I call for the vote?
Could I interject something? Sorry, this is Corinne Gartner, legal counsel to the board. I just want to remind the board and follow up on some of the comments that were, public comments. This is not a prohibition on adding flavoring agents. That's not what's being proposed. I think the board does need to keep in mind the significant potential conflict of law issue that this bill would present to practitioners in California. And I think the other thing to keep in mind is that any comparisons to what other states are doing
is not really relevant to this board's consideration of this issue because other states don't have the same jurisdiction and authority that this board does in California.
Thank you.
Yeah, I was just wondering, could staff respond to the concerns that this would eliminate the current status quo as it relates to flavoring in community pharmacies?
So I can tell you that there are states where their law explicitly states that adding flavoring is compounding, and I do believe that flavoring still occurs in those jurisdictions. Is there a state-by-state comparison? I would have to go back and do that. I think, and I'm happy to do that and bring it forward to the extent that jurisdictions vary in how they handle things. And so I'm happy to try to provide some additional context, but I am aware of, some states that do require flavoring to be treated as compounding.
But with this, how has there been any? Do we know if this bill is opposed and if the bill fails, how would it affect the status quo of flavoring in California's pharmacies as is? Would it affect the current status quo, or would it maintain it?
So I think that's a bit of a theoretical question, so it's kind of hard to answer. I would say that a statement was made that you would have to be a compounding pharmacy to do that, and that's not my understanding. Any pharmacy can do it. They just would need to comply with the USP requirements. And so I think that it's kind of hard to guess, and businesses are going to make decisions whether or not they are providing any service, right? HIV, PEP, and PrEP, immunizations, flavoring. It's a business decision, and where you make the decision to provide something, you need to comply with the law. I don't know that I can totally answer exactly what businesses would do.
So I can just echo, just echo what Ann is saying, because we've had significant discussion over many meetings in the Enforcement and Compounding Committee, and certainly you can't guess or determine what businesses are going to do when regulations require more time or more effort to provide a current service. That happens a lot in all areas, not just in healthcare, where regulations changed and now I need to fill out more forms or I need to do more documentation. So that part of the discussion we had in the Compounding Committee is that we do not want this to become a barrier, and we want to work with pharmacies to help them to follow the national guidelines and document what they're doing. But it's not required any special licensure, any special documentation from the board's perspective. It's just a documentation on that prescription that you actually write down, I'm adding flavoring, what it is, how much, and a few other things that are required when you do compounding. You're required to document the specifics of the actions of the pharmacist or the technician during the compounding. So I guess to answer your question, because I know you're concerned about access, we don't know what businesses are going to do. Businesses can choose to not document, then they don't provide that service, which is not really a service to their patients.
So I got a couple of questions or concerns that statistics have been quoted by at least a couple of the speakers that there is no documentation of harm, but there's certainly a non-zero possibility of substitution happening, that a certain number of pharmacies deciding to not do this compounding. So certainly there is a non-zero chance of certain patients not getting the service versus what is quoted as a zero documentation of harm. So to my understanding, what statistics or what examples do we have that suggest that having a proper documentation outweighs what is, again, quoted as a zero risk currently versus certainly a non-zero number of substitution happening? That's number one concern. Second concern is, if we are to consider this as a compounding, then will they have to submit the sample for the potency testing as well? or will that be exempted because that is something a lot of compounding pharmacies have to do? That's also a additional cost that may prevent or they may fuel to the substitution that I previously mentioned. So have we had any deliberations on both of these topics?
Oh, absolutely.
I think this is valuable discussion, but I think when you look at what this bill will achieve, it won't change the national requirements and the enforcement of the board. So should this, my understanding, and the attorneys can probably say it better, should this bill pass, flavoring would still be compounding in California because California has other laws that require us to enforce USP standards. So that would be the conflict. When there's a conflict, that causes confusion. And the best way to avoid the confusion is to avoid the conflict.
Also, just to chime in, I know with several documents that have been provided in the materials, there has been mentioned that USP is not an enforcing body, which is true, but there needs to be a standard, and USP is the standard. And so being consistent with USP, it seems like second nature, I think. I mean, we have pretty high standards in California anyway, as we should. I mean, we're dealing with pediatric medications. I'm glad that there's no reports of any harm done. I wonder how much of that is because it's not documented, how much we're actually using flavoring and additives. We don't have to do it at all, it sounds like, in a lot of states. And so particularly with children, I think that population alone, for me, indicates that we need something needs to change, and just for consistency of the law and also setting a standard for our state and where our laws and enforcement actually stems from. Any other comments? Great. Let's see, so we'll go for the vote. Jose, how do you vote?
Yes.
Thank you. Trevor, how do you vote?
Yes.
Thank you. KK, how do you vote?
No.
Thank you. Maria, how do you vote?
Yes.
Thank you. And I vote yes. The motion passes. Members, Assembly Bill 913 would require the board to license and regulate pharmacy benefits managers as specified. This would require the board to promulgate necessary regulations and prepare a report to the legislature on or before August 1st, 2025, then annually thereafter. I agree with the comments from staff that implementation of the measure would be a significant undertaking, but has the potential to address significant patient care challenges that currently exist. The measure would also address inequities that currently exist in pharmacy reimbursement models. As was announced during our last meeting, the measure has become a 2-year bill. The board has a support position on this bill. Members, do you have any comments or questions on this measure? Hearing none, we will now accept public comment from individuals participating in the Sacramento location.
My name is Steve Gray. I've been involved with PBMs, not representing PBMs, but am very much aware of their activities as a past president of the Academy of Managed Care Pharmacy at the national level and working with various other states. I just want to call to the board's attention what has already been said, that this is now a 2-year bill, which means that it's got time to go through, but there is already pending at the national level bills to regulate PBMs. They're quite diverse. They're across the country, the bills that some states have. We have a problem then with, well, how do you regulate PBMs at the national level, et cetera? So I would just encourage you, whether you go forward with support or whether you change that is not what I'm saying. Just be sure to watch what's going on at the national level with the bills that are pending in the U.S. Congress right now, so that you can understand all of the complexity and what's going on with regulating PBMs. And the various states have taken different approaches. One of the things I would suggest also is you might want to ask the people that print the pharmacy law book to include the sections in the law book in California law that already govern the PBM audit responsibilities. Those were put into law in 2006, I believe, and yet they're not in the pharmacy law book. So a lot of pharmacies don't know that a lot of their problems they're having with PBMs could be avoided because the audit requirements are already part of California law. And if the pharmacists were aware of those, they'd realize that they already have remedies for many of the problems they're having with PBMs. Thank you. That law, by the way, was originally going to be under the jurisdiction of the Board of Pharmacy. The Board of Pharmacy objected, and it's under the jurisdiction of the Department of Managed Health Care, and so that's probably why it's not in the pharmacy law book. But I think that pharmacists and pharmacy owners need to know what their rights are regarding PBM audits, and they're quite extensive. Thank you.
Thank you. Seeing no other public comment in Sacramento, moderator, we're now ready for public comment from individuals participating via WebEx.
Thank you. We've opened up the WebEx Q&A to facilitate public comment. Anyone who wishes to comment, we do want to take a moment to circle back to Ned Milenkovic, who had a technical issue, and so we're going to put that 30 seconds back on his time. So Ned, I'm going to send you a request to unmute. And you're unmuted.
Well, I'm not sure where you lost me because I was speaking and I was cut off. I will only tell you that 503A does not apply to this situation. Federal law does not apply to this situation. You can certainly go ahead and pass a law in the state of California, and it has no effect on the federal law. 503A is for different purposes. And I will also tell you that the legislature is doing your job for you, Board of Pharmacy. They are the ones protecting the citizens and the residents of California because you are failing to do so, and you should support this bill.
Thank you.
And now moving on to the current set of comments. Are there any comments on the current topic? Again, anyone may raise their hand or look for the question mark icon, and our call-in users may press *3 to request a comment. And I do not see any further requests for comment. Shall I close that feature?
Yes, please. Thank you.
You're welcome.
I will now bring the discussion back to members. If there are no additional comments, I will move on to the next measure.
I just was wondering if we could have staff look into the opportunity that was referenced by the person, I'm sorry, forgetting the name, but about including the current law that we have in our pharmacy law book. Do you know if there's a possibility of that about, sorry, I was trying to look at PBMs and pharmacist recourse, and including that in our pharmacy law book?
So the online version, which is the version that we maintain, I believe does have the language. It's a third party that sells a thing. We can reach out, and we don't have a relationship with them, and I don't know how many vendors there are out there, but we can reach out to the one that we are aware of and make a suggestion, but it'll just be that.
Okay, thank you.
Thank you. Moving on to the next measure, members, Assembly Bill 1060, would make legislative findings regarding the naloxone hydrochloride as a medicine that can counter overdose effects when administered timely to reduce opioid overdose deaths. This measure would prohibit healthcare service plans, health insurance plans, and Medi-Cal from imposing a cost-sharing requirement, including a copayment or deductible for coverage provided, and shall require the plan to cover the cost of a prescription or non-prescription naloxone hydrochloride. The board has a support position on this measure. The measure is on the Senate Appropriations Suspense file. Members, do you have any questions or comments on the measure?
Just to the extent possible, if we could find a way to communicate to Senate appropriations, because I know some things tend to die on the suspense file, just the massive importance of this bill and the board's significant and unanimous support of it, making naloxone as available as humanly possible as a direct life-saving medication. Again, coming from San Francisco, this is something that we deal with on a daily basis, and the more we can make this available, the more lives we can save, and the more barriers that can be removed to making naloxone available. There's only benefits that can be made from this. So just to the extent possible, we can emphasize our support for this to the Senate. I think would be good. So thank you.
Thank you. We will now accept public comment from individuals participating in the Sacramento location. Seeing no public comment, moderator, we are ready for public comment from individuals participating via WebEx.
Thank you. We've opened up the WebEx Q&A to facilitate comment on the proposal. We are on number 1060. Are there any comments? If you would like, you can raise your hand. You may look for the question mark icon and type the word comment and click send, or our call-in users may press *3 to raise their hand. Each person will have 3 minutes with a 10-second warning. Are there any comments? I do not see any requests for comment. Shall I close that feature?
Yes, please. Thank you.
You're welcome.
I will now bring the discussion back to members. If there are no additional comments, I will move on to the next measure. Okay. Members, Assembly Bill 1286 is the board's patient medication safety bill. This measure was recently referred to the Senate Appropriations Committee. You will note that the measure has been amended several times to address concerns from the opposition. The basic tenets of the measure remain present, although some different approaches are now in place. As an example, the measure now includes authority for the board to issue a cease and desist where conditions exist within a pharmacy that pose an immediate risk of death, illness, or irreparable harm to patients or staff. This amendment was to address concerns from the retailers. Originally, the measure would have provided authority for the PIC to close the pharmacy. The most recent amendments include clarification that the board may publish de-identified information compiled from medication error reports. This was to address an issue raised by Senate Judiciary Committee staff. I remain excited about the board's measure moving forward. The provisions in the measure have the potential to significantly reduce medication errors and improve patient care. Members, do you have any questions or comments on the measure?
One question, so does it still, the bill as it currently stands, still provide the authority to the pharmacist in charge to close the pharmacy, or is that now solely within the Board of Pharmacy's purview?
My head shaking is probably not super helpful, sorry. Yeah, so it's no longer the PIC that can close the pharmacy. The request was to have that with the board. So similar to our ability to close a pharmacy, issue a cease and desist in sterile compounding, we will now, if this bill goes through, have the authority to do that, issue a cease and desist for a period of time specified under specified conditions.
And so if, because I know one of the big concerns regarding this was, let's say, unsafe work conditions, or there wasn't enough staffing, or sickness, et cetera. If a pharmacist felt the need, would they reach out to the Board of Pharmacy and say, please issue a cease and desist, or would this require a proactive effort of the Board of Pharmacy?
So as it's drafted, there needs to be, if I'm going based on memory, which I should never do, but the PIC or the pharmacist needs to notify the management of the pharmacy, and I believe if it's not remedied within 24 hours, then there's notification to the board. The language is clear, however, that a pharmacist can reach out to the board before that, but there is the provisions to allow for them to remedy within 24 hours as well.
Okay, thank you.
Actually, I do have a follow-up question on that. Does it specify who they would contact from the board, or is there going to be a special line for that?
So how we operationalize it will be a public discussion that we'll do. Generally, it's through the enforcement committee.
Thank you. Any other member comments?
Was there any amendment regarding the floor of the staffing level?
I think the best way that I can answer that, KK, is to say that that's a work in progress. Assemblymember Haney, I'm not speaking on behalf of his office, but he has made public comments that he is, still looking to see if there's a way to address some of those concerns.
Thank you. We will now accept public comment from individuals participating in the Sacramento location.
Hi again, Lindsay Goldhorn with the California Community Pharmacy Coalition. We are opposed to AB 1286, but I do want to express our great appreciation to the board, to Anne for working with us, to the author. Really appreciate the amendments on the closure piece. I think we got to a place where that will be workable and achieve the goals that the board is looking to accomplish. We do have some remaining concerns. The staffing floor is one of our remaining concerns. We'd like to see some exceptions for situations where that just isn't workable. 24-hour pharmacies, after hours, low-volume pharmacies, maybe the weekends, and hope to continue to work with the board and the author on that. The ratio piece is also a concern for us right now. The bill has a limited expansion of the ratio. As you know, it allows for a second tech, but that tech can only do certain duties, such as vaccinations and some other duties. And we feel that that, unfortunately, will not be, in practice, workable when you have one tech there doing technician duties and then the other tech there just to do those extra duties and then not doing the other technician duties when they're not doing those extra duties. So we would love to see a pure 1 to 2 expansion if that's possible. The last thing I wanted to touch on, the bill on the medication error reporting piece. As we've commented before, we would love to see compliance if a pharmacy is already reporting to patient safety organization. Absent that, and I think maybe the language reads this way, but we would love to see some clarification that if a pharmacy is already reporting to a patient safety organization, if that PSO then is reporting medication error data to the entity designated by the board, that is considered compliant. So again, I hope we can get some clarity there, but really appreciate all the work that the board has done with us on this and hope we can keep having those conversations. Thanks.
Great. Thank you. Seeing no other public comment in Sacramento, moderator, we're ready for public comment for individuals participating via WebEx.
Thank you. And if anyone would like to make a comment on Assembly Bill 1286, you are welcome to either raise your hand by clicking on the hand icon or look for the question mark icon and type the word comment and click send, and our call-in users may press *3 to raise their hand. We do have a raised hand from someone logged into WebEx as Peggy Binzer. Peggy, I'm going to send you a request to unmute. You'll have 3 minutes with a 10-second warning. And you're unmuted.
I am Peggy Binzer. I'm with the Alliance for Quality Improvement and Patient Safety. We are the professional association for patient safety organizations and their healthcare provider members. We presented a few meetings ago on the benefits of patient safety organizations. Today, we'd like to limit our comments to the medication error reporting aspects of the bill. We recommend that the language of the bill be amended to require that pharmacists or their patient safety organizations report medication errors that have caused serious patient harm to a PSO of the board's choosing. We're making this recommendation because PSOs are proven to improve medication safety by creating a learning system that's for the benefit of patients. We also believe that allowing community pharmacy PSOs, including component PSOs, to report to the prescribed patient safety organization will improve the effectiveness of the program because the PSOs have established learning systems and distribution systems and can assist with the implementation of any best practice developed by the board-selected PSO. Allowing this flexibility will also reduce implementation costs and resources, including staffing that would be required to accomplish this separate reporting for the program. We recognize that in the past that the board has been concerned that if a PSO were the organization that was collecting events such as an ISMP PSO or Pharmapod PSO, both have PSOs that would be perfect for this purpose, that would prohibit the board from seeing the patient safety work product, from seeing the medication error reports. And this isn't true. The 2016 HHS federal guidance provides that providers, including pharmacists, can permissibly disclose this information reports to meet external obligations, such as any obligation that's created under this bill. So I'm very glad and happy for having this opportunity to comment on the medication error provision of the bill, and I'd be happy to answer any questions that you have and work with you to make this change. Thank you so much.
And this is the moderator, and at this point, I do not see any further requests for comment. Shall I close the public comment feature now? There are no requests for further requests. Shall I close public comment?
Yes, please. Thank you.
You're welcome.
I will now bring the discussion back to members. Are there any additional comments? Okay. The only thing I wanted to highlight and just remind everyone, it seems to come up pretty often in the discussion about AB 1286 with the expansion specific to the technician roles. You know, there can be more than one technician working in a pharmacy. It just means that one technician can be performing clerk duties. They just can't be doing tech duties. So if you are in a situation where maybe there's no more immunizations, et cetera, that second technician can continue helping at the register, answering phones, entering prescriptions, which is a lot of the ancillary help we do need in pharmacies. So I just want to remind everyone that this doesn't prohibit pharmacies from hiring more technicians. If there are no other comments, we can move on to the next measure. Members, Assembly Bill 1341 would establish temporary authority for a pharmacist to furnish COVID-19 therapeutics until January 1st, 2025, under specified conditions. Pharmacists have been performing these functions under a waiver issued by the Department of Consumer Affairs, as well as provisions of the PrEP Act. This measure is being considered today as part of the Assembly Appropriations Committee. The board has a support position on this measure that is on the Senate third reading file. As I noted during our last meeting, pharmacists have been safely providing COVID-19 therapeutics throughout the public health emergency. You may recall that the board originally established a support if amended position, as the board believes permanent authority is appropriate. However, consistent with the board's policy, President O authorized a change in the board's position to one of a straight support because of concerns that the board's initial request to make provisions permanent could inadvertently create problems for the urgency provisions contained in the measure. Members, do you have any questions or comments on the measure? Great, we are ready for public comment from individuals participating in the Sacramento location. Seeing none, moderator, we are ready for public comment from individuals participating via WebEx.
Thank you. If anyone would like to make a comment on Bill 1341, you may raise your hand by clicking on the hand icon. You may look for the question mark icon, click that, type the word comment and click send, or call-in users may press *3 to raise their hand. Each commenter will have 3 minutes with a 10-second warning. Are there any comments on 1341? I do not see any requests for comment. Shall I close the public comment feature?
Yes, please. Thank you.
You're welcome.
I will now bring the discussion back to members. If there are no additional comments, I will move on to the next measure. Members, Assembly Bill 1557 is also a board-sponsored measure. The measure will make permanent authority for a California licensed pharmacist to perform medication chart order reviews from a remote location within California on behalf of a California licensed healthcare facility licensed under Health and Safety Code Section 1250 under specified conditions. As amended, the measure also includes an urgency provision. The measure enjoys support from several organizations, and the measure is back in the Assembly pending concurrence with Senate amendments. Members, no action is required on this measure. I would welcome your comments. Hearing none, we are ready for public comment from individuals participating in Sacramento. Seeing no public comment, moderator, we are ready for public comment from individuals participating via WebEx.
Thank you. If anyone would like to make a comment on a currently discussed item, you may look for the question mark icon, type the word comment and click send, or you may raise your hand by clicking on the hand icon, and our call-in users may press *3 to raise their hand. Each commenter will have 3 minutes to speak with a 10-second warning. Are there any requests for comment? I do not see any requests for comment. Shall I close the public comment feature?
Yes, please. Thank you.
You're welcome.
I will now bring the discussion back to members. If there are no additional comments, I will move on to the next measure. Members, Senate Bill 339 would authorize a pharmacist to furnish up to a 90-day course of PrEP or beyond under specified conditions. It would require the board to adopt emergency regulations by July 1st, 2024. Further, it would require health plans and health insurers to cover PrEP and PEP, including medications furnished and tests ordered by pharmacists as specified. The bill addresses some of the challenges discussed during the Licensing Committee's recent post-implementation discussion on pharmacist-provided PrEP and PEP. Further, it updates the law to allow for flexibility in treatment by removing the specified type of PrEP authorized to be furnished, and it provides a means by which a pharmacist can continue to provide care beyond the 90 days under specified conditions, including that a patient receives testing and follow-up care consistent with the CDC guidelines. The board has a support position on this measure. The measure recently passed out of Assembly Business and Professions Committee and was referred to Assembly Appropriations Committee. Members, do you have any comments or questions on this measure?
Yes, I just want to say how important this measure is, and I'm glad I'm seeing that it has unanimous support. Every AIDS HIV infection is preventable now, and this is going to help it be even more preventable to make sure that healthcare and cost doesn't stand in the way of preventative treatment. So just very excited for this and very grateful for Senator Wiener for carrying this bill, and looking forward for doing it to again, putting California on the forefront of HIV/AIDS prevention.
Thank you. Very well said. We are ready for public comment from individuals participating in Sacramento. Seeing none, moderator, we are ready for public comment from individuals participating via WebEx.
Thank you. If anyone has a comment on Senate Bill 339, you may look for the question mark icon. To click that, type the word comment and click send. You may raise your hand by clicking on the hand icon, and our call-in users may press *3 to raise their hand. Each commenter will have 3 minutes to speak with a 10-second warning. Are there any comments on Senate Bill 339? I do not see any requests for comment. Shall I close the public comment feature?
Yes, please. Thank you.
You're welcome.
I will now bring the discussion back to members. If there are no additional comments, I will move on to the next measure. Members, Senate Bill 345 would prohibit a board from suspending, revoking, or denying a license of a person based solely because the licensee provided legally protected activity as defined. Legally protected activities include the exercise of rights related to reproductive health care services or gender-affirming health care services. The board has a support position on this measure. This measure also recently passed through Assembly Business and Professions Committee and was referred to Assembly Appropriations Committee. Members, do you have any questions or comments on the measure?
Not to hog the mic, but just want to say again how important this is. We see around the country the threats faced on abortion, healthcare, as well as it relates to trans kids and the attacks on trans kids across the country, and making sure that again California not only remains a bulwark in protecting this care, but is being as proactive as possible is incredibly important. And so grateful for Senator Skinner for doing this bill, and grateful for the Board of Pharmacy for being proactive and supporting it as well. So anything we can do to continue to protect both our pharmacists as well as the people and the consumers of the state of California and across the country really helps set us apart. So proudly continue to support this bill.
Thank you. We will begin with public comment from individuals participating in the Sacramento location. Seeing no commenters, moderator, we are ready for public comment from individuals participating via WebEx.
Thank you. If anyone would like to make a comment on Senate Bill 345, you can look for the question mark icon, click that, type the word comment and click send, or you may raise your hand by clicking on the hand icon, or our call-in users may press *3 to raise their hand. Each speaker will have 3 minutes with a 10-second warning. Are there any comments on the Senate bill? I do not see any requests for comment. Shall I close that feature?
Yes, please. Thank you. I will now bring the discussion back to members, and if there are no additional comments, I will move on to the next measure. Members, Senate Bill 427 would prohibit prior authorization or step therapy for medications approved for the prevention of AIDS or HIV under specified conditions. The measure would allow for prior authorization or step therapy if at least one therapeutically equivalent version is covered without prior authorization or step therapy. This measure recently passed through Assembly Health Committee and was referred to Assembly Appropriations Committee. The measure was amended in the Health Committee, and although the amendments were not in print while preparing for the meeting, according to an analysis, it appears the amendments are in response to concerns regarding implementation. The board originally established a support if amended position, believing the measure was appropriate but could go farther to help patients. Based on amendments that strengthened health care coverage protections, approval was given to change the board's position to support. Members, I welcome your comments and would entertain a motion if you believe such action is appropriate.
Just to clarify, so are you looking for a motion to support or?
Yes, to change from a support if amended to a support position.
Got it. Yeah, I move to support.
Thank you.
I'll second that.
Thank you. Members, do you have any questions or comments on the measure? We'll begin with public comment from individuals participating in the Sacramento location. Seeing no public comment, moderator, we are ready for public comment from individuals participating via WebEx.
Thank you. If anyone would like to make a comment on the motion involving Senate Bill 427, you can look for the question mark icon, type the word comment and click send. You can raise your hand by clicking on the hand icon, and our call-in users may press *3 to raise their hand. Each person will have 3 minutes to speak with a 10-second warning. Any comments on the motion? I do not see any requests for comment. Shall I close that feature?
Yes, please. Thank you. So we'll move on to the roll call vote. Jose, how do you vote?
Yes.
Thank you. Trevor, how do you vote?
Yes.
Thank you. KK, how do you vote?
Yes.
Thank you. Maria, how do you vote?
Yes.
Thank you. And I vote yes. The motion passes. Sorry, one moment. Okay. Moving on to the next measure. Senate Bill 544 would create permanent authority for remote board meetings under specified conditions. The measure was recently heard in Assembly's Governmental Organization Committee. It is my understanding that the measure passed out of the committee with amendments. Although the amendments are not in print, it is my understanding that the amendments would require that 50% of the board's meeting would require at least a quorum of members to be present in public locations. These amendments appear significant, but would still establish a pathway for some members to participate from a remote location. I believe the board's support position still remains appropriate. Members, do you have any questions or comments on the measure? Hearing none, we will begin with public comment from individuals participating in Sacramento. Seeing no public comment, moderator, we are ready for public comment from individuals participating via WebEx.
Thank you. If anyone has any questions or discussion about the Bagley-Keene motion, you may look for the question mark icon, type the word comment and click send. Click the once on the hand icon to raise your hand, or our calling users can press *3 to raise their hand. Each speaker will have 3 minutes. Are there any comments? And I do not see any requests for comment. Shall I close that feature?
Yes, please. Thank you.
You're welcome.
I will now bring the discussion back to members, and if there are no additional comments, I will move on to the next measure. Senate Bill 816 was recently amended and now includes the board's fee proposal. As a reminder, the board's fee proposal seeks to recast the board's fees consistent with the independent fee analysis performed. Some fees will be reduced, some remain the same, and others will be raised. The measure passed out of Assembly Business and Professions Committee and was referred to Assembly Appropriations Committee. Members, do you have any questions or comments on the measure? Hearing none, we will begin with public comment from individuals participating in the Sacramento location. Seeing no comments, moderator, we are ready for public comment from individuals participating via WebEx.
Thank you. If there are any comments on the Senate Bill 816, you may look for the question mark icon, type the word comment, and click send. You may click once on a hand icon to raise your hand, and our calling users may press *3 to raise their hand. Are there any comments on Bill 816? I do not see any requests for comment. Shall I close that feature?
Yes, please.
Thank you.
I will now bring the discussion back to members. If there are no additional comments, I will move on to the next measure.
One question, following up. So, and with this, if this passes this year, we feel confident that the board is en route to solvency as far as making sure that we have the necessary reserves required, and this bill should effectively mitigate the deficit that we were looking at?
Yes.
Sweet, perfect. And I think it's also noteworthy, I just want to confirm, even with the increases in some, and obviously we're decreasing in others, we've gotten no pushback from any licensees as relates to fee increases?
So I have not heard any. I did reach, when the bill went into print, I did reach out to some of the stakeholders that routinely participate and have not received any concerns.
Great.
Thank you. Members, Senate Bill 873 would require the cost-sharing savings of a prescription drug based on rebates received to be calculated at the point of sale as specified by requiring the health care service plan or insurer to provide the information to the dispensing pharmacy. The board has a support position on this measure. The measure was recently referred to Assembly Appropriations Committee. Members, do you have any questions or comments on this measure? Hearing none, we will move on to public comment from individuals participating in the Sacramento location. Seeing no public comment, moderator, we are ready for public comment from individuals participating via WebEx.
Thank you. If anyone on WebEx would like to make a comment on Senate Bill 873, you may look for the question mark icon, click that, type the word comment, and click send. You can click on the raised hand icon to raise your hand, and our calling users may press *3 to raise their hand. Each speaker will have 3 minutes with a 10-second warning. Any comments on Senate Bill 873? I see no requests for comment. Shall I close that feature?
Yes, please. Thank you.
You're welcome.
Members, Senate Bill 887 is a measure that includes a board-sponsored provision to change the deadline for the board to submit its legislative report on the use of automated drug delivery systems to coincide with the board's sunset process. This measure also includes provisions for several other programs with the Department of Consumer Affairs. The measure was recently referred to Assembly Appropriations Committee with the recommendation that the matter be placed on the consent calendar. Members, do you have any questions or comments about this measure? Thank you. I will turn it over to public comment in Sacramento. Seeing none, moderator, can you please open the line for public comment via WebEx?
Certainly. If anyone would like to make a comment on Senate Bill 887, you may look for the question mark icon, type the word comment, and click send. You may raise your hand by clicking on the hand icon, or our calling users can press *3 to raise their hand. Each speaker will have 3 minutes with a 10-second warning. Are there any comments on Bill 887? I do not see any requests for comment. Shall I close that feature?
Yes, please. Thank you.
You're welcome.
And I'll turn it back over to members if there's any additional discussion. Great, thank you. So we just have a little bit more to get through. Moving on to the regulations portions. Members, all of the items included in the regulations portion of the report are for information only. As detailed in the meeting materials and associated attachments, the board has several regulations in various stages of promulgation. I do not intend to review each item as the information is contained in the public materials. I note that the board staff is currently drafting the post-adoption final rulemaking documents for submission and reviews by several agencies, including the Department of Consumer Affairs, before submission and review by the Office of Administration Law. The board currently has 6 regulations undergoing review by the Department of Consumer Affairs or Business, Consumer Services, and Housing Agency. Additionally, staff are preparing the initial rulemaking documents for 3 rulemaking for pre-notice review and working on the Section 100 rulemakings related to self-assessments. Members, do you have any questions or comments on those regulations? As we begin public comment, we will begin with comment from everyone in the Sacramento location. Seeing none, moderator, we are ready for public comment from individuals participating via WebEx.
Thank you. And if anyone has any comments on the board staff rulemaking, you may look for the question mark icon, click that, type comment, click send. You may raise your hand by clicking on the hand icon, and our calling users can press *3 to raise their hand. Any person wishing to comment will have 3 minutes to speak with a 10-second warning. Are there any comments or questions? I do not see any requests to comment. Shall I close that feature?
Yes, please.
Thank you.
Thank you.
Just one question. Are we going through each area, or did you go through 5 through 8 together as a group? I might have missed that.
I believe it was 5 through
5 through 8 together? Mm-hmm. Then I do have a question on 8. I'm sorry.
Okay.
It says attachment 5 includes timelines for each of the regulations, and I wasn't sure if it is timelines or maybe something else, because I didn't see any timelines in attachment 5. I'm sorry, I didn't ask earlier, but I'm just, if there's timelines, then that's missing. But if it's the full assessment, those were included.
We will confirm and make sure that there are timelines for each of them included in the board meeting materials.
Thank you.
Perfect. Any additional member comments? Okay, thank you. Members, if there are no additional comments, we'll proceed to review and discuss the committee's strategic objectives. As indicated in the meeting materials, the Legislation and Regulation Committee has 6 strategic objectives. The meeting materials include updates to the respective objectives over the past year. These updates highlight the work of the board in our policymaking efforts to protect California consumers. I note that there are 2 objectives for which there are no status updates, including 3.1 related to advocating for provider status and 3.4 related to identifying opportunities to leverage pharmacists to increase access points for care. Specifically related to 3.1, I believe this is a federal issue. I recommend that it may be appropriate to receive a presentation in the future on the status of federal legislative efforts in this area. Further, specifically related to 3.4, I believe after some of the working conditions are addressed through the Assembly Bill 1286, it may be appropriate to consider ways to increase patient access to care. I believe the work done by the Standard of Care Enforcement Model report lays out some areas for consideration related to this objective. I'm looking forward to future discussions. I believe the objectives remain appropriate and do not believe any changes are necessary. Members, I would welcome your thoughts on the strategic objectives. Seeing none, as we begin public comment, we will start with public comment in the Sacramento location.
Thank you. Steve Gray, commenting on 3.1 and 3.2. It says, consider and advocate for necessary changes regarding recognition for provider status for pharmacists to improve patient access. You mentioned in your comments just a few minutes ago that you believe that was a federal issue. I would say it really is also a state issue. We do not have, for an example, official recognition of provider status for pharmacists as individuals under Medi-Cal. And even if this were to change at the federal level for Medicare, that doesn't necessarily mean it's going to change across the United States for Medicaid, which of course we call Medi-Cal in California. Several other states have not waited for the federal government to change the provider status, meaning that individual pharmacists can bill for their services under Medicaid, and I think that that's still something that the board could help facilitate. We did have a little bit of progress in that area with an Assembly budget bill, I believe it was an Assembly budget bill, a couple of years ago, where the Department of Healthcare Services, which is of course the Medi-Cal department, said that they would cover the clinical services of pharmacists for a few specialty drugs. But that has yet to be implemented. They have yet to provide a way for pharmacists to be credentialed and to be paid for those services. And so I think that that is something that the board should include or consider. It's not just at the federal level, it's also at the state level. And that is especially important, as you know, for Medi-Cal, because over 50% of the residents of California are under Medi-Cal. About 30-some% of adults and over 51% of children are under the Medi-Cal program. And so it is very important for them to have the benefits of all the pharmacist education, training, and experience, and pharmacists to be able to provide those services and be compensated for it. And then the other part of provider status, of course, is in the private industry. And I think with AB 317, which is not a board bill, but AB 317, that will go part way to getting true provider status for clinical services. So I think that should be recognized as the board is supporting AB 317 and some other related bills, such as the bill for HIV coverage and PEP and PrEP and so forth, where pharmacists are going to get paid for those services. So when we say provider status, that's usually what we mean, is that the pharmacist can get paid for, or their services can be covered, whether they're paid directly or indirectly for that status. So that's my comment. Thank you.
10 seconds.
Thank you. Seeing no further comment in Sacramento, moderator, we are ready for public comment from individuals participating via WebEx.
Thank you. And if anyone else has a comment on the strategic goals and objectives, you may look for the question mark icon, click that, type the word comment and click send. You may look for the hand icon, click that to raise your hand, and our call-in users may press *3 to raise their hand. Each speaker will have 3 minutes with a 10-second warning. Are there any comments on the objectives? And I do not see any requests for comment. Shall I close that feature?
Yes, please. Thank you.
You're welcome.
I will bring the discussion back to members. Do you have any additional comments? Great. I just want to say I appreciate the public comment, and I look forward to further discussion on provider status in future meetings. So we are ready to adjourn for the day. I would like to thank everyone for your time and participation. Our next meeting is currently scheduled for April 11th, 2024. Please watch the website for updates on this meeting. Thank you.
Sorry, could I just clarify? Is it April 11th or April 4th?
I have 11th in my script.
April 11th.
Okay.
Thank you.